Good afternoon, everyone, and welcome to our weekly COVID briefing. As is usual, I'll turn the podium over to Dr. Fitzgerald for her update. Thank you.
Thank you, Minister. Good afternoon, everyone. Thanks for joining us today. I'll begin with an update of COVID-19 in our province. Since the media advisory yesterday, we have no new cases, and the total number of cases in our province remains 283. 271 people have now recovered, and in total we have tested 47,366 people. As you may know, many countries and Canadian provinces are experiencing a second wave of COVID-19. As anticipated, we have started to see new cases in our province this past week as a result of travel. Thankfully, there has not been any community spread of the virus here in Newfoundland and Labrador. Any transmission that has occurred has been limited to close contacts of affected travellers. I understand that these new cases may create fear and anxiety for some individuals, particularly after our province has had lengthy stretches without many cases. The reality is that we will continue to see new cases. The goal here is containment of the virus to prevent spread. I thank all the travellers entering our province who are self-isolating in accordance with the requirements. And just to refresh everybody's memory, anyone who travels into the province from outside the Atlantic bubble, with the exception of essential workers, certain essential workers, or rotational workers, they are required to self-isolate on their property for 14 days after return to the province. You cannot leave your property except for to receive urgent medical attention. You cannot drive in your car, and you cannot have contacts with others in your household. I once again ask everyone to be kind to individuals who test positive for COVID-19. Please consider how these individuals may be feeling as they cope with this diagnosis, and then only to face harsh public criticism, particularly on social media. We need to support these individuals, not only because it is the right thing to do, but also because we want people to feel safe in coming forward to be tested if they develop symptoms. It is vital that we know about any cases in our province so that our public health system can respond quickly to ensure that close contacts are identified and the virus is contained. We are aware of new information that has come forward with respect to a recent case in Central Health. Public Health is following up on this new information, and through that process will identify any close contacts of the case during the infectious period. These persons will be notified and advised to quarantine. We are also closely monitoring the recent increase in COVID-19 cases occurring in the Moncton and Campbellton regions of New Brunswick. If you are traveling to New Brunswick from Newfoundland and Labrador, you should limit the number of close contacts to as few as possible, maintain physical distancing, practice frequent and proper hand hygiene and respiratory etiquette. Travelers from these regions of New Brunswick entering our province should self-monitor for symptoms of COVID-19 and avoid attending any large gatherings or crowded public spaces for 14 days after arrival. At this time, the outbreaks in New Brunswick are regional, and there is no evidence to support Newfoundland and Labrador leaving the Atlantic bubble. As we monitor epidemiology of COVID-19 across Canada, we are carefully considering the impact on non-essential visits to Newfoundland and Labrador during the Christmas season. I know that the pandemic has resulted in lengthy separations for some families, and many have held out hope that they may be able to reunite over the holidays. Ultimately, we will make a decision in the coming weeks as we assess the risks to the health of our population. In good news, we anticipate the launch of our influenza vaccinations later next week. It is important to get the flu shot each year, but this year it's even more important as we enter influenza season during a pandemic. Our focus is on keeping people healthy and safe, thereby avoiding the need for hospital visits or admissions due to respiratory infections. To illustrate the impact of influenza, during the 2019-20 season, there were 708 laboratory-confirmed cases of influenza in our province. Of these, there were 92 hospitalizations and 9 influenza-related deaths. And I will note that these are only the lab-confirmed cases, so there are many more cases of influenza out there every year that don't get lab testing done. To ensure maximum uptake for this year's vaccine, there will be more options for people to access the vaccination. Residents of the province will be able to get a flu shot from their family physician or local pharmacists at no cost. We will also be offering the Flu Zone high-dose influenza vaccine to those living in long-term care and personal care homes who are age 65 and older. Regional health authorities will be holding clinics following public health guidelines to ensure safe administration during the pandemic. Information will be coming soon on how to book an appointment for a clinic. Our goal is a vaccination rate of 85%. This is higher than our historical uptake, but it is important for us to achieve in order to preserve the resources in our acute care system. This is the reason we try to flatten the curve for COVID-19, and the same principle applies to influenza. Finally, I would like to add that last week marked 4 weeks into the trial period for rotational workers to avail of a COVID-19 test on day 5 of their return in order to have a reduced self-isolation period. We are currently evaluating the results of this trial, and rotational workers can continue to avail of this process while the evaluation is underway. As a recap for those who may have just joined, we have no new cases since yesterday's media advisory. The total number of cases in the province is 283. The coming weeks and months may be more challenging, but we have proven we are up to the task. Let our collective response be one of compassion and perseverance. Thank you, Newfoundland and Labrador.
Thank you very much, Dr. Fitzgerald. It is day 221 of our media releases and availability. Again, it's a testament to the hardiness and diligence of the people of this province that we have the numbers that we see when contrasted with other jurisdictions who haven't, unfortunately, fared so well. I'd like to develop a little bit of Dr. Fitzgerald's comments around anxieties that positive cases generate, both in the province but also in communities where these occur. This is perfectly natural. One of our challenges is to make sure we create an environment in which people who do have symptoms feel able to come forward without concerns that they will in some way be stigmatized or suffer ill simply because of having the test or a positive diagnosis. We, from government and public health, have something of a balancing act to do around how we go about presenting our information. I think each of us has a responsibility. Those people who have traveled or who have symptoms should follow public health advice, and the expectations are laid out quite clearly. Dr. Fitzgerald has repeated some of them. Similarly, in the situation where you develop symptoms, one should go and get tests after discussing this with 811 on public health. Each of us has a responsibility to act with some degree of compassion and kindness for those people who may find themselves having to isolate or quarantine, either as a result of necessary travel or as a result of coming into contact with someone who may have been positive. One of the challenges we've seen over the entire COVID period has been some of the noise, as it were, around social media. It goes right back to March, where some people thought it was quite amusing to create a video suggesting that we had no entry controls or entry screening at the airport. And that sucked an enormous amount of oxygen out of the department to try and pin down what was essentially a hoax. We've seen misinformation around cars with out-of-province license plates, when these were actually Newfoundlanders who found a different way of coming home, but a more identifiable one. A significant number of our rental cars carry out-of-province plates, and people leap to assumptions. But again, people have a responsibility to follow the rules, and equally, I think we all have a responsibility to be very careful on social media about sharing rumors. It is very easy to cut and paste or to copy someone else's post simply because you may know of them or know them, and disseminate information that is not actually accurate and at best is hearsay. And I think the challenge there again is from a public health point of view. We spend significant manpower and effort chasing down these rumors. Equally, if you as a responsible citizen are aware of someone who you feel has actually not followed the rules, there is a complaint process, a complaint form, and that will be managed by people who have different investigative skills than public health and communicable disease nurses. And social media, Facebook is not the place to report these. We have no mechanism to monitor everyone's posts. It is clear on the website how this information can be conveyed, and it will all be acted upon. The vast majority of it, in actual fact, quite frankly, has turned out to be inaccurate or innocent mistakes, and we have had very good compliance, very good responsibility from the people of this province. Moving on from that, I would like to just address a topic I brought up last week. We've been discussing with the federal government about rapid tests. These are molecular tests which mimic the bigger tests we do in the lab, and also the antigen tests, which are slightly less sensitive but faster still and require minimal, if any, training. We have negotiated with the federal government to get our share based on our population, which was a difference from their original stance. The exact numbers we're not sure of. They will be coming into the province over the next couple of weeks, both types, and their role and how they will be deployed will be a discussion between ourselves and the federal government, as they will be supplying the kit for these. Our aim is to make sure that they are deployed in a way that makes good public health sense. So rural areas with transportation difficulties or isolation issues, particularly as the winter comes on, will be the preferred initial site. We'll have more information on that over the next week or two as the federal government's position and recommendations become clearer on these two new types of kits. They are, however, quite plain at the moment that this is for symptomatic individuals who are close contact of cases or people who are advised to get this on the basis of public health advice. We do not yet have a point of entry screening tool. There is not one anywhere, with the exception of 14 days of self-isolation. So again, drawing to a close before I hand it back to Ms. Dix-Payton, I'd just like to thank everybody for their efforts so far and repeat what I said several times over the course of the last few months. This is not a sprint. This is life with COVID-19, not life hiding from COVID-19. And we will have this with us in some way or form for some length of time. And it's important that we don't get fed up with the situation we find ourselves in. Just take a deep breath, and just like winter, this too shall pass, but we have to live with it while it's here. So with that, Kathy, over to you.
Thank you, Minister. For the benefit of our speakers, we have 5 reporters registered for today's call. We will conduct a question and answer session in 2 rounds, where each reporter will have the opportunity to ask 1 question and 1 follow-up per round. If time permits, there will be an opportunity for further questions. We suggest that you not ask rumor-based questions. The purpose of these briefings is to address COVID-19 issues. All other government-related issues should be directed to the appropriate department or agency for response. Reporters will ask questions in the order they registered for today's call. Our first questions are from Peter Jackson of The Telegram. Please go ahead.
Hello, and welcome back, Dr. Fitzgerald. We're not supposed to bring up rumor-based questions, but since you both apparently alluded to it, I'm wondering whether you can specifically state what sort of situation are you looking into in Central Health?
So there was more information that came forward. I can't really speak to specifics because of privacy issues, but more information did come forward that suggested that perhaps we had to look a little further for contacts, and that's what public health is in the process of doing right now. So anyone who is considered a close contact during the infectious period, that's very important to remember, that they will be notified that they are a close contact and that they have to quarantine and advised to get tested.
Okay. So can I ask whether that will be something that will be announced publicly, or whether it will just be contact tracing in the normal sense?
So, I mean, we haven't made a point of announcing contacts being traced, other than to say that it's happening and that they've been advised to isolate. But if there is any information that comes out of that investigation where we feel public safety is of concern and we need to release further information, we absolutely will.
Okay, thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
Dr. Fitzgerald, what would you have to see in New Brunswick in order to reinstate quarantine or other travel restrictions?
Certainly with regard to New Brunswick, we would be seeing more community spread, so what we'll be looking for are what we call non-epi-linked cases, so cases where we couldn't find a source of infection. So the information that we've received from New Brunswick at this point doesn't indicate that, and certainly they've done a very thorough job at doing their investigation. It's been a very stressful week or so for them, for sure, and they're working very hard to make sure that they're getting all these contacts identified and quarantined, and so we are watching the situation closely. We're in fairly regular contact, almost daily contact, and we'll certainly be, if anything changes, we'll certainly make recommendations to that effect.
How much risk is there right now if someone is traveling from, for example, Moncton or Campbellton? They're allowed into the province. They don't have to isolate. What's the risk that they could bring the virus here and spread it because they don't have that isolation period?
So the risk at the moment, certainly in those areas, it is slightly higher than, say, it would be in other areas of New Brunswick, but it is, it's still not real high, and certainly when they come back into the province, we've asked people to stay away from higher risk areas, so crowded places and any large gatherings. People are wearing a mask when they're indoors in public spaces. So, we've already instituted a fair number of precautions that would help to protect in this situation.
Thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. When it comes to the exemptions to get into the province, and this is outside of the Atlantic travel bubble, Minister Haggie, you've mentioned before that we could crack down on that if need be. As we see cases rise across the province, is this something we're still looking at?
The whole exemptions issue in the special measures orders that we have is reviewed on a frequent basis, and it's reviewed in the light of where people are coming from. We've certainly had an unofficial discussion with one other territory that seemed to think we would make a nice bubble partner, although we haven't done anything more than simply be aware of that. Looking at the peaks or the rising curves in other jurisdictions is always a cause for concern. But again, we feel that the bulk of travel at the moment, by and large, tends to be related to essential, in the sense it's rotational workers who have jobs out there, and they have a special, as it were, protocol, which is currently being evaluated. But obviously, if the situation changes dramatically and starts to affect us, then we'll get probably a few days' notice of that, and that would be the time, I would think, which Dr. Fitzgerald would probably make some other recommendations.
Thank you. In regards to your comments there, which territory in particular is looking to join our bubble, and has this been discussed with the other Atlantic provinces?
The answer to the last question is no, and as it wasn't just one, I'm not going to put anybody on the hot seat. That was a casual conversation, and it wasn't an official one.
Thank you.
Our next questions are from Elizabeth Whitten of All Newfoundland and Labrador. Please go ahead.
Thank you. With the recent spike in cases in New Brunswick now exceeding 80, from your perspective, Minister or Doctor, what's the future of the Atlantic bubble and Newfoundland's participation in it, and what would it take for us to pull out of it?
So at the moment, we're not considering that. New Brunswick is looking for cases, and so because they're looking for cases, around, an outbreak investigation, they're likely going to find them. And that's a good thing if they find the cases they're looking for, right? So this is, at the moment, from the information that we're getting, and that's being shared, on a regular basis, we wouldn't consider closing borders to New Brunswick at this time. As I said, if we were to see extensive community spread happening or starting, then that we would have to reconsider things.
And I'm curious, what is the protocol if Newfoundland and Labrador starts seeing a sudden spike in cases? What would be the immediate action? Would we go back to shutting things down like we did in mid-March?
So if we start to see an increase in cases, there's a couple of things with that. We actually have to think about where those cases are coming from. So again, if we saw cases that were related to an outbreak that was a very specific outbreak and it was very well contained, that might not require us to make any changes. If we were starting to see cases that were as a result of a source where we couldn't identify, or an infection where we couldn't identify the source, that would be a little more worrisome, and so we may want to make changes in that situation. Our goal, obviously, is not to have to go back to any kind of a lockdown, but certainly, we would have to look at the situation specifically, and if we were seeing outbreaks related to one specific type of business or a specific industry, then we may have to consider making some changes specifically in those areas. So our goal at this point really is to be more tailored, is to be more refined in our approach to how we tackle the spread of this disease. If everyone can keep doing what they're doing and, keep the number of contacts small, then the risk of that kind of spread is much lower. And in fact, I think some of the lessons learned from some of these outbreaks that we're seeing, I noted it in a news article this morning that in one area in Ontario, when they were doing their contact tracing, that contacts had up to 50 other contacts. That makes it much easier to spread the virus. It makes contact tracing much more difficult and labor intensive and takes longer. And we know that speed is of the utmost importance with this virus to be able to do that contact tracing. So I cannot stress enough the importance of keeping the number of contacts outside of your household bubble as low as you can, and to avoid situations where you're in with people that you don't know in close circumstances. So, remember people, space, time, and place. So the more people you're around in enclosed spaces, the longer you spend with them in indoor settings versus outdoor settings, the higher your risk is going to be of contracting or spreading COVID-19.
Minister, did you want to add anything to that?
No, I think it's interesting that we're a little ways into the question period, and really a lot of the questions are about what's happening in other places and how are we going to react to that. And I think Dr. Fitzgerald just hit a very important point about people, space, time, and place. When you have 50 contacts in 24 hours or 48 hours, that is way more than is wise. And we heard from Dr. Rahman right back at the beginning when we had all our efforts in alert level 5, that 3 contacts outside your bubble in 24 hours was the safe spot. 6 was probably manageable, but once you passed 11, the risk of disseminating the disease and triggering a rush in the R0 was really a major one, and 50 is way off the chart.
Thank you. Our next questions are from Richard Duggan of VOCM News. Please go ahead.
Dr. Fitzgerald, earlier on you mentioned that a decision will be coming and public health officials are looking at the potential for travel over the Christmas period. If that were to be allowed to happen, what would that have to look like in your opinion?
That's what we're trying to sort through, so I'm not going to make any predictions about what that's going to look like at this point in time, but we are considering it. We are considering that question seriously. We know how people have, how the importance that families put on the Christmas season, and that it is a time that traditionally a lot of people come home to visit. But we also have to think about where people are coming from and what the risk is. and the risk of spread in the communities if we allow that. So those are all things that we're talking through. We're considering at this point in time, and to be honest, at this point, it's probably just a bit too early to really make any kind of prediction. But it is something that we're looking into.
And I just wanted to ask, the English School District has begun a phasing in of extracurricular activities, and here at VOCM we've heard from an advocate who has called the approach too cautious and wants to see activities reinstated more quickly. What would your recommendation be on that front?
We're certainly in the process of having conversations with education and the school districts about this sort of thing, and we have put guidance in place for sports organizations, and I guess the schools can follow some of that guidance as well. But the districts have to put in place guidance that they feel comfortable doing, that they feel is within the capacity of the school to be able to do safely. I mean, this is really about the safety of our kids, so we have to, I think it's better to take baby steps in the beginning and be able to expand that if we need to as time goes on, rather than go too fast and then we end up in a troublesome situation. So, but it's the school district and the schools themselves have to be comfortable ultimately with how this is going to be rolled out.
Thank you.
Our next question is from Peter Jackson of the Telegram. Please go ahead.
Passengers on the Falmouth ferry, they say they're required to go on deck now, stay in close quarters with other passengers, which presents some risk. Is there some change in policy? Because originally on Marine Atlantic they were allowing people to stay in cars. Has that changed?
My understanding, Peter, is that is a Transport Canada mandated change. Transport Canada classifies ferry vessels as having open or closed decks. They use criteria I'm not exactly sure of, but on that ferry they have deemed that to be an enclosed deck, and therefore for safety reasons they have mandated that our operators move everybody off the vehicle deck. They have the ability, and I've stated to my colleague, Minister Bragg, as far as he's told me, that for every person who stays on the deck, they are going to levy a fine of $14,000 against the operator, and that will be for each trip, for each person. This is their ruling, and Minister Bragg's department is trying to deal with that.
Okay, thank you. And Dr. Fitzgerald, Dr. Teresa Tam said this week thinking on aerosol spread may have to change, that may affect the protocols for PPE. And the Nurses Union has informed me that some of their members are still being denied N95 masks even when their care assessment indicates a necessity. Is there any possibility that there'll be more robust protection for people on the front lines?
So as we've always done, our recommendations regarding PPE will be based on the best evidence that we have, and certainly there are conversations that are happening about, aerosolization and the appropriate PPE. I will leave that to the infection prevention and control experts, and any, as I've said, any information that comes down through that group we'll be certainly looking at and taking very seriously. The point of care risk assessment has always been there and is certainly, we're not going against a person's point of care risk assessment to if they felt that they needed to use an N95, for example, as PPE for caring for a patient. So. That's always been there and always been something that's been allowed. I can't really speak to the rest of it. I guess it's out of my purview.
Thank you.
Our next questions are from Peter Cowan of CBC News. Please go ahead.
You touched on this a bit earlier with the talk of the territories. the Northwest Territories has specifically said that they would be open to joining the Atlantic bubble. Considering they have no active cases compared to New Brunswick, more than 80, why are we not allowing them in when we do allow New Brunswickers in?
That's an issue as much for the Council of the Federation and the Premiers. They have a role to play in those decisions and did around, CAP, the Council of Atlantic Premiers, in terms of the Atlantic bubble. Speaking from personal experience, having been to the Northwest Territories on several occasions, you cannot get to there from here without overnighting, usually in Calgary or Edmonton or maybe even Toronto.
So under what conditions would you be open to allowing folks from the Northwest Territories or other territories which have also done a very good job of controlling the disease to come in without requiring a quarantine?
That's a twofold question, one for the Premiers and one for public health. I can't speak for the Premiers and wouldn't presume to do so.
Dr. Fitzgerald from Public Health?
Our Atlantic bubble is there's the ability to travel directly from from one Atlantic province to another. So I guess that would be first and foremost. We'd have to ensure that ability was there. But to speculate on something that hasn't really been a serious discussion at this point, I don't think would be appropriate.
Thank you.
Our next questions are from Kellyanne Roberts of NTV News. Please go ahead.
Thank you. Dr. Fitzgerald, you spoke about the flu vaccine earlier and the high dose of it. I didn't know there was a difference between the flu vaccine and a high dose of it, but some people wondering who specifically will be getting the high dose version.
So high dose flu vaccine has been, it's basically a double dose of some of the antigen, we call it, in the flu vaccine. So it has been shown to be a little more effective than regular dose flu vaccine, and in people who are over the age of 65, and especially those who are frail elderly, so people living in long-term care facilities and personal care homes and things like that. So we are providing that flu vaccine to that group of people this year.
Okay, great. Thank you. I'm also wondering, I'm sorry, I'm just looking for it here. Oh, here it is. Over the weekend, the Prime Minister congratulated Canadians on making the COVID Alert app the top downloaded in the Apple and Google stores. Do you have an update on numbers on this? Because we know as of 2 weeks ago, we only had roughly 800 positives nationwide reporting themselves through the app.
I'm not sure,
Sorry,
Minister.
I was on mute. Sorry, Janice, do you want to take this?
No, I was deferring it to you.
Kellyanne, that's a good question. What we do know from numbers is that the federal government, because of privacy concerns, only released its national numbers. Last week or the end of the week before, I think we were at 3 million downloads, and we're now up to 4. So there is an increased uptake. Quite frankly, with a population of between 32 and 36 million in Canada, we need, for that to do the things it truly can do, we would need at least a 70 or 80% uptake. That situation that Dr. Fitzgerald alluded to in another jurisdiction, where you have 50 or more contacts in a short period of time, is where that app would really work. Very few people can list off the names of the 50 individuals they spent time with in the last 48 hours with any accuracy or reliability. This is the strength of that app. It is totally private, totally secure, and the information is stored on your phone and it's under your control. You would simply get an alert, a code, if you had been in contact with someone who was positive. That's calculated on a signal sent out to your phone, and it's up to you what you do with it. I would encourage you as responsible members of society to respond to that and allow access to your data. But again, it's only for 2 weeks that's stored, and it's safe, and it has the endorsement of all of Canada's jurisdictions' privacy commissioners.
Thank you.
Our next questions are from Elizabeth Witt of All Newfoundland and Labrador. Please go ahead.
Thank you. I'm not sure if this is a bit old news. news, but I'm curious about the testing capabilities here in the province in the lab. I know a few months ago there was talk of waiting on a new piece of equipment that would kind of up our production or testing capability. So I'm wondering where we are now.
I can deal with that. We actually have 2 fully functional new machines in addition to our slightly older one. One of these is in the process of being replaced, and we will then have 3 plus the old one. And on a medium-term basis, we have an order in for 2 more, which will be hopefully arriving in the new year. And out of an abundance of caution, we will probably physically locate those somewhere else in an Eastern Health facility in town rather than public health lab, simply to guard against power or flood issues with having all of your machines in a single location. Currently, we have little difficulty in processing the samples that we're getting, and we have some capacity of significance to deal with a surge.
Excellent. And I was wondering if you can give me a rough number of what our testing capabilities are right now. Like, how many tests could they do in a day?
At the moment, they could go up to 1,500, and then there's capacity beyond that. And as I say, as the 3rd machine comes online at Public Health, and then we get the new machines afterwards, that may more than double by the time they're all commissioned in the winter.
Thank you. And our next questions are from Richard Duggan of VOCM. Please go ahead.
Thank you. We've heard from people wondering about restrictions in regard to St. Pierre and Miquelon. We have a close relationship with St. Pierre and Miquelon. I was just curious, are there any discussions ongoing to ease or change those restrictions?
No, is the bottom line. They have an agreement, St. Pierre and Miquelon, with Eastern Health to provide secondary and tertiary healthcare services. They, through the federal government, have an exemption which will allow them to enter St. John's for the purposes of medical appointments or medical treatment, on the understanding that the rest of the time they isolate, and that there is a PPE protocol that's required of them, and they should notify the health authority when they're arriving. So that's a particular thing for St. Pierre, and that has not changed. And my understanding at the moment is there is no intention of changing that.
Thank you. And I was just curious that we have the online COVID reporting form. I was just wondering if there's any update on the numbers of reports being received through that form.
Hang on a second. I might actually have that in front of me. On the other hand, I might not. I can certainly find that out for you. We'll get the numbers that have gone through the COVID app. I can't find it on this a piece of paper I have in front of me just at the moment.
Thank you.
Peter Jackson, do you have any further questions?
I have a quick follow on the flu. So in terms of distribution, are schools and long-term care homes still going to be receiving these shots directly, and also do doctors have them available yet?
Sorry, Peter, you were breaking up there a little bit. Can you repeat it?
Sorry about that. I just want to get an update on flu shot distribution. Are they actually going to be sent to schools and long-term care homes as the original plan called for? And also, do doctors have these? And if not, when will they have them in store?
So doctors can order flu shots this year, so they'll have to order them from their respective regional health authorities, and they'll get them in the usual way that they have gotten them in the past. And long-term care facilities are provided with these vaccinations as well, and personal care homes will be provided through, I guess, the providers that will be going in to do flu shots in that situation.
At school?
So schools will be done likely by public health. So schools themselves won't be provided with flu shot. The public health professionals will be bringing that with them when they go in to do any vaccinations.
Okay, thank you.
Peter Cowan, do you have any further questions?
Yes, thank you. Looking at the high-dose vaccine for seniors, I noticed you mentioned that it is going to be made freely available for folks in long-term care homes. Why isn't it going to be available to all seniors who would benefit with their relatively lower immune response to the regular vaccine?
So the seniors at highest risk are those that have comorbidities and that that are frailer, and so certainly those living in long-term care facilities and in personal care homes are where the highest risk is. This is the first year that we've provided flu zone HD, so we're certainly looking at the response we get with this vaccine this year, and we'll be evaluating whether or not that gets expanded at any future time. But at the moment this year, it is just for this group because they are at highest risk.
I want to just follow up on something from the other Peter a minute ago about schools. There was some talk originally about having flu vaccination clinics be in schools before we see the regular public the regular public vaccinations, and in fact maybe even opening it up to families to encourage better uptake. So where do schools stand right now in terms of the plans of when they will get vaccine and how will it be administered?
So I think that's variable with each of the regional health authorities and perhaps even with the schools, depending on the size of the school and things like that. So I don't know that it would be fair for me to comment in broad strokes about that, but there's good communication lines between public health and the schools, and I'm sure that those things will be worked through as we move along.
Okay, thank you.
Kellyanne Roberts, do you have any further questions?
No, thank you.
Elizabeth Witt?
No, thank you.
Richard Duggan?
No, thank you.
Well, with that, we'll turn it back to the Minister for some closing remarks.
Thank you very much, Kathy. I won't keep everybody. We've gone beyond our allotted time. Just a heads up for the media that this time next week, we will more than likely be doing our availability on the Tuesday of next week at 12:30, just afternoon. We will confirm that with a media availability, but this is to accommodate the House of Assembly sitting next week. Thank you very much.
Thank you very much for tuning in, everyone.